అవగాహన ఉన్న పట్టణ ప్రాంతాల్లోనే మాస్క్ ధరించడాన్ని పెద్ద ప్రహసనంగా భావిస్తున్నారు. అంతంత మాత్రం చైతన్యం ఉన్న గ్రామాల్లో పరిస్థితులు ఎలా ఉంటాయో అర్థం చేసుకోవచ్చు. ఎలాంటి మాస్కులు వినియోగించాలి, ఏ మాస్క్తో ఎంత రక్షణ అని వారికి విడమరిచి చెప్పేవారు తక్కువే. ఫలితంగా మాస్కుల వినియోగంలో నిర్లక్ష్యం వహించి ప్రాణాల మీదకు తెచ్చుకుంటున్నారు పల్లె జనం. ఈ సమస్యకు పరిష్కారాన్ని సూచిస్తున్నారు ఈటీవీ భారత్తో ప్రత్యేక చర్చలో పాల్గొన్న నిపుణులు. అసలు ఏ మాస్క్ సమర్థవంతంగా పనిచేస్తుంది, మాస్కుల తయారీలో ఎదురవుతున్న సవాళ్లు ఎలా అధిగమించాలి లాంటి అంశాలపైన తమ అభిప్రాయాలు పంచుకున్నారు.
At least in the urban centers, we have some kind of infrastructure for people to go and get their tests done, or probably even advocate for tests to be done at home and look at the ways of testing that can be done also. But in rural India, what are the challenges that are there that prevents testing from being done, identifying those who have the infection?
Currently, testing is being done at the community health center, that's the CHC level, right? The facility is not available at PHC or sub-center level. The one CHC serves a huge cluster of villages, and the travel time is a lot. So people, if they develop mild symptoms initially, they tend to defer testing for a long time unless they end up with a more severe form of the disease. When they have mild symptoms, they're actually spreaders who are going around attending festivals, attending marriages, and creating clusters. Add to that, it has traditionally been seen that in India, especially in rural areas, people first seek care from the local quacks. And that's very prevalent, and we cannot deny that. It has never been seen over the past 5 or 6 years that I've been around in rural Madhya Pradesh, in this district of Guna. So that's very concerning. So I think rapid testing at the household level, by empowering our health workers, people working at the PHC, using the staff that is available at our disposal, that is there at our disposal, is the key over here. Rapid testing needs to be done on a massive scale at regular intervals to be able to pick up cases at the right time when they are actually spreading the virus the most, to encourage them to home isolate and to initiate them on treatment as and when required.
Dr. Dhilan, what is the kind of health emergency that you see in India where we have to do something immediately to stop the spread?
Yeah, I think the two immediate actions that are relatively low hanging and that they can be implemented nearly immediately. One is widespread dissemination, promotion, and really encouraging uptake of these high-five masks that Deva Bhaktuni was talking about. And if you think about it, there's instances where we have a confirmed COVID patient who's coughing a lot. They have a high-five mask on. I have a high-five mask on. The possibility of me getting infected in that scenario, high-five masks can happen immediately. And that I think is the lowest hanging opportunity. And it can almost function as something like it functions similar to a vaccine when worn appropriately and widely. Second thing is figuring out how to do restrictions. And what I mean by restrictions is lockdowns of some sort in a humane manner, whereby we're providing economic and social supports to communities. And then third to that, I think to slow transmission would be trying to basically either mass procure plus or minus mass produce rapid tests and getting them out there with a lot of promotion on how they should be used, both via channels that exist in communities such as ashas and anganwadis, and also in places where possible, having people themselves self-test and then be able to self-isolate. Those are three things that can happen in a matter of days to weeks.
Dev Bhaktuni, now everybody is speaking about the mask. Now, when it comes to India, on the online platform also, there were a lot of masks available. Everybody was selling masks online. Everybody was making masks available on the streets. But do those masks actually protect us would have been the big question. So what do you think about having a streamlined, standardized procedure that has to come from the government because it's a regulatory procedure? Don't you think it is time for that as such? Because if those right masks have to reach...
The masks that people are wearing are doing some good. So I don't want to give the impression that they're no good. They're doing some benefit. They've shown benefit in different parts of the world. They've done cross-regional studies showing people wearing masks get lower infection, even if they're any old mask. However, they are not good enough. You need to have a much higher standard. And there have been efforts to come up in the United States as well, to come up with new standards for consumer masks. However, those get stuck, and those are long-term efforts that take a long time. So that's why, because a lot of people have to agree and they have to come up with a completely new thing. So using established standards like N95, like KF94 from Korea, which is available in high volumes, some of the FFP2 from Europe, or even reusable N95 masks. This is a reusable N95 mask, and you don't have to buy it again and again. It's available in India as well, and it's designed for industrial settings, and they've been around for many years. It has a very good fit because of the elastomeric surface, and you put it on like this, and like this, and you just use it for up to a year. And similarly, there's ones for like this as well. They're a little more costly up front, and so these are all things that are existing already. And so I would encourage just taking off-the-shelf products and using them today, as opposed to waiting for the future where there will be, yes, we can do better in the future, and that will take time. But there are many good alternatives. That if you go to patientknowhow.com, I've actually curated a number of them, that you can check. And
in fact, the most commonly available are the surgical masks that are available.
Yes.
And that is what most of the Indians have been, in fact, been having with them. Also, a critical question that they ask is, how long can you use an N95 mask?
That is also an excellent question. And, there's no good answer to that. Even the CDC in the United States doesn't have a good answer to that. If it's a mask like this, designed for reliability, oil can fall on it and it still works. That's for like heavy industrial area. You can use it for even up to a year. But if it's a disposable mask, it may last much shorter. So it all depends on how often you need to use it. If you're maintaining it and it's available to use, you can use it. And the surgical masks is a really excellent question. Some of them have a good filtration, but what you can do is you can buy something called a fitter. And then because these masks don't have a good fit, they're very loose, you put this fitter on and it provides a seal around the face so that it clamps to the face like this, elastic material. And that actually can make you a very effective mask. And so that's actually a very scalable and immediately actionable solution, better than double masking.
Another challenge that we have is that you need to produce masks for such a huge population. So people tend to, in fact, look at the cost factor. At the same time, if they have to replace it, that also becomes a cost factor. And the right masks are not reaching. We can rope in our small scale industries so that we can actually scale up production of this. Do you think that is the way forward for something like this, where we can actually, on patent production or on licensed production, we can in fact go ahead and scale up this process so that at least people get the right mask? Is that a possibility?
Definitely. And in fact, there are so many alternatives. And in fact, US manufacturers are actually, say they have excess capacity, and some of them are actually sending them to India right as we speak, to the Delhi government, and they're starting to send massive shipments, millions and millions of masks. Yeah, so there are many manufacturers and a large industry ready to do this for you. So they think of it that way. There's not a huge supply constraint. There's actually a demand constraint.
Adrish Bhadra, you have seen how people have been masking in rural India. What do you think is in the rural sector? What are the challenges that when it comes to just distribution of masks that we are facing over there?
Well, I think in the rural areas, there has been the chronic problem of using high quality masks all through. N95 being relatively expensive is not something that people in the rural areas can afford every now and then. So we are actually looking into this possibility. We are trying to push for surgical masks and mask fitters in rural Madhya Pradesh, and let's see how that turns out to be.
Dr. Dhillon, now you saw the challenges, you heard the challenges that we have, especially on the mask front, and that mask is supposed to be one of the primary defenses against this particular pandemic. What is our situation at the moment?
Certainly, this is a catastrophic emergency across the board. We know what can be done to stop this. And so certainly at a federal level, yes, you need political support to see that happen. And even more so at a state level, you need to see that driven, because that's really where execution happens. But second to that is taking initiative locally too. There's phenomenal actors in all communities, whether they're part of the local government system or part of nonprofit systems or part of just community groups. They're in place.
Well, in fact, I'll give the last words to Devbhaktuni Sri Krishna now. We require people on the ground, entrepreneurs or common people who would like to take this challenge out. So how do you think that the government should go forward? What is your opinion, or what is your suggestion to actually meet this challenge?
Excellent question. We need to use the solutions that are available today off the shelf from existing manufacturers that are actually available, that they have excess supply already. You need to take the N95, the KF94, the FFP2 from wherever it's available and bring it to India. Start using it to stop the spread. And separately, the mask fitters is an excellent concept. This is taking surgical masks that are available in great volumes already. And I'm wearing it right now. This is a mask fitter from US by a company called Fix the Mask. What it does is before I wear the mask, my eyeglasses are fogging up. After I wear the mask, no more fog. It has sealed my face very tightly. This is all pretty much as close as you can get to an N95 type protection using a surgical mask. And so it's an excellent thing. This can be manufactured locally very quickly to just enhance the fit. I think if you just take what you're already doing and enhance the fit, you'll have the protection that you need to stop the spread. So it's, in fact, the local entrepreneurs can start making fitters. There's an open source design on their site, Fix the Mask, that they can be spread. This is also manufactured. They're going to scale up the manufacturing. So really focusing on fit and filtration, and we can get out of this pandemic.
Fit and filtration, and therefore we have to in fact bring our Indian ingenuity into it, and also our resolve to fight against this pandemic. It's been one of the biggest challenges.
And scaling it up
after our independence, and we are all in fact trying to ensure that India does see a good future, and the current crisis can in fact be mitigated as soon as possible. Thank you, gentlemen, for in fact speaking to ETV Bharat. It's been quite a pleasure to speak to all of you all and get your insights with regards to the current pandemic.